Will taking another vaccine dose prevent long COVID is a question we've been asked. Long COVID is troubling a lot of people, doctor, and then comes this news of this latest COVID scare. How should one deal with it?
So there is a lot of concern about long COVID, and we're still learning some more and more about it. We've been seeing patients who continue to have some symptoms of long COVID even months or a year after they've had COVID. There's also data which suggests that those who've taken the vaccine, especially those who've taken the booster shot, they tend to have less long COVID, and this does give some protection against long COVID. Therefore, I would really urge people who have not taken the booster shot not only to protect themselves from the new variants, but also to have some protection from developing long COVID, to actually take the booster shot, because some data does suggest that it may help or decrease the chance of long COVID.
Okay. Let's come back, doctor, to China and, travel. Because you've got different parts of the world where we've seen a surge: Japan, South Korea, United States, China, of course. Should foreign travel be allowed? We are heading into Christmas and New Year. Should Indians be encouraged to travel abroad, or should we be cautious?
So I think we can't, it wouldn't be practical, and it wouldn't make sense to ban travel completely. One has to be careful, and maybe the high risk group, and especially the elderly, need to be extra careful if they're traveling in terms of COVID appropriate behavior. But we already have data which suggests that the new variants have already present in our country. So therefore, it's not that this is going to be something new which is going to come into our country. The BF.7 has been reported by INSAGOG over the last few months. And we may have even more cases if we did testing and did genome sequencing aggressively, and more people came forward and got themselves tested. Therefore, I think it's not going to make much of a difference even if we sort of ban air travel, because the virus has already entered our country. I would say that we should encourage people to follow COVID appropriate behavior. If they've not taken the booster shot, to take the booster shot. But traveling, having a blanket ban on travel may not actually really serve any purpose.
So which effectively almost answers my next question, which was, is domestic travel also risky? I think the point I'm making, doctor, is that this is a season where there'll be lots of crowds, weddings, holiday season. Should we, I'm traveling tomorrow, let me tell you, on my Christmas holidays. Should I be even at all thinking about cancelling it or regulating the kind of parties that I go to?
So what I would really say is that if you have an indoor party, if there is a big crowd, please wear your mask and try and have some degree of social distancing if possible. If it's an outdoor party and it's really a bigger area like a lawn or a garden, then still one is safe because the chance of transmission becomes less. But when you're traveling, it may be a good idea to keep wearing your mask and also to regularly wash your hands. So COVID appropriate behavior is something that we need to do, and I don't think there is a need to really panic. It's not something that we should all cancel our holidays. I think it's been a long time after which one is celebrating New Year by having celebration in the real sense. So I think we are not in a situation to really say that we should stop all of this. Our cases are very low, and we're not seeing any admissions as far as hospitals are concerned.
I just also wanted to know, doctor, if lots of people are getting respiratory ailments, this is that time of the year, should the moment I get a respiratory ailment or get any kind of flu, go and get myself tested for COVID?
Yes, so there are two parts of this. One is a large number of people are getting flu-like symptoms. It may or may not be COVID, because this is the time when you get a lot of respiratory infections, and many a times it's influenza or a flu itself. And the treatment by and large remains the same. People just take paracetamol, hydrate themselves, take multivitamins, vitamin C, and they become all right. But I would really say that if you have COVID, don't only rely on the rapid antigen test, go and get the RT-PCR test done, because that will provide a database to how many people are actually having COVID and what is the variant that is circulating. Currently, we don't know that because the large number of people are not coming forward and getting the RT-PCR test done. Either they're just taking symptomatic treatment, or they're just getting the rapid antigen test done, and if it's positive, They just isolate themselves, take symptomatic treatment, but don't report it. And therefore, we don't really know how many cases are we seeing of COVID during the winter months, how many cases are we seeing of influenza, and what is the variant which is currently circulating in our country, because the number of testing has really come down.
But are you saying, sir, that can an RT-PCR in India detect this BF7 variant clearly? It will detect it without a problem?
The RT-PCR will tell you whether this is COVID or not, but all RT-PCR samples now which are COVID positive go for genome sequencing, and by genome sequencing you will know what is the variant, and you will come to know definitely if it is BF.7.
You know, are heart attacks a long COVID effect? We've seen in recent times, doctor, people in the age group of 40s, early 50s, very fit otherwise, suffering from heart attacks. They had COVID possibly in the first and second wave. This law, you know, you said that there's not enough data on long COVID, but is that one fear that maybe those who've got long COVID are susceptible to heart trouble?
Yes, that is a cause of concern, and like I said, we need more data. But yes, there are reports of people who've had COVID and a few weeks later have suddenly had a heart attack or dropped, had suddenly collapsed and died of an acute heart attack. It's possible that this could be related to the endothelial or the inflammation in the vessels that COVID causes. Also could be related to the heart muscle involvement that can happen because of the virus. But we need to have more data to really show a cause and effect relationship. Is this definitely a cause, or is it just more incidental? And also, what is the mechanism behind it? And also, can we predict who is at a higher risk for developing this? I would really say that we should also sort of recommend that all people who recover from COVID should be slow in terms of going back to a lot of physical activities, going back to the gym. They need to do it slowly, because it seems to be one of the risk factors that you recovered from COVID and you suddenly start exercising very aggressively, you have a higher chance of developing heart-related issues.